let's talk a little health with Dr. Kumar. The number of people infected by the coronavirus, it's continuing to rise globally. Right now, there are more than 24,000 cases, almost 500 deaths. Dr. Kumar, of course, here to talk a little bit more about that. So you said it best earlier. It's out of the bag.
It is. The cat's out of the bag, and now it's time to kind of rein it all in. And like you said, it's already spread in Asia. You know, hindsight's 20/20,
right?
And if you had to do it all over again, you know, when those very first cases were reported, and we understood the historical perspective of SARS and MERS, other coronavirus epidemics, you know, swine flu, things like that. If you had to do it all over again, you might have imposed stricter travel requirements and bans and quarantines earlier on in the course. But, you know, like I said, hindsight's 20/20. Didn't understand exactly how effective it would be and how much people would travel. So there's already, you know, many countries that are affected with this. In our own country, you know, it's relatively quiet. We shouldn't freak out about this. You know, there's only been 11 cases that have been confirmed. There's still about 80 or 90 that are pending, whether or not they have active virus. It's affected 4 states, Washington, Nevada, there's Massachusetts, Illinois, Arizona. And so just a few states with a few people, but it's something to be aware of. And, you know, we've been depending on people self-quarantining and self-addressing it. But it's time for, you know, for the public institutions to have a role as well.
Right. And I think right now there's an increase, maybe not fear, but maybe just curiosity with the folks being quarantined in San Antonio. So it might be more questions. Should folks worry about that?
Yeah, you know, it's a good question. It's a tough balance to find, right? I mean, public safety ought to be paramount. You know, that like other pandemics and epidemics, you know, there's the ability for this to spread person to person, and there is a finite death rate to this. You know, out of 24,000 people, let's not blow it out of proportion. You know, out of 25,000 people that were infected, 500 people have died, which is a high rate. But you know, the flu, as you were talking about earlier, you know, kills way more people than that every year, and we're not freaking out about the flu, even though we ought to be every year. So this, you know, this is controllable. However, it is infectious. There is death, and if we don't pay attention and use our public institutions to address it, then we could be in trouble. So I don't think it's overreacting at all to decide that we need to quarantine people that might be exposed until we know exactly what the public safety concern is. If they're infected, if they're able to transmit it, I think that it's quite reasonable. I don't think it's blowing things out of proportion to prevent the spread of this disease, and used all equipment that they have to bear, you know, all the measures you have, you know, travel bans and preventing things. It seems, you know, when you're concerned about the public health, that it's in one of the tools in your armamentarium that you shouldn't just neglect.
Right, absolutely. And you mentioned it earlier. I mean, I pulled the numbers from the CDC, 500 deaths of coronavirus globally, and then just here in the United States, the CDC reports 25,000 deaths. So I guess the bottom line here...
From the flu.
Yes, from the flu. So I guess the bottom line here is just wash your hands. Be precautious.
You know, self-care and looking out for the public starts with the individual. You know, and certainly getting that vaccine for the flu. You're right. You know, if you're worried about corona, if you're wondering about the world and the state of the planet, did you get vaccinated? Did your kids get vaccinated against the flu, which is going to spread to way more people than the coronavirus, which is going to kill way more people than the coronavirus this year, next year, and last year. And so it is. You wash your hands, take care of yourself, take care of others, self-quarantine, and if you're sick, don't go to school, don't go to work. These are simple measures that we all could share, and we'll all have better health.
Okay, perfect. Thank you so much, as always, Dr. Kumar. And if you have a question for Dr. Kumar, email us at askdrkumar@gmail.com. Of course, don't forget to like him on Facebook and visit his website.